Arthritis really is a black box term to describe any joint pain. Itis means inflammation, arthro means joint. So anytime someone comes to a doctor's office and they have a pain in their joint, they typically get the diagnosis of arthritis. It generally comes in two forms. There's one called osteoarthritis, which is the most common form. We call it the wear and tear kind of arthritis. And basically it's about the joint wearing out inside. You wear down your cartilage, or you injure your meniscus in your knee, let's say. In some way, you're actually wearing out the joint. The other form, which is less common but also relatively common, is called rheumatoid arthritis. And that's more of an autoimmune disease where your immune system actually attacks joints and creates damage in them. The symptoms are a little bit different in both. Both cause joint pain. Both can limit range of motion. But the joints that are involved in those two kinds are different. The wear and tear arthritis, the osteoarthritis, is more in larger joints, hips, knees, shoulders, like the weight-bearing joints in your body. And the rheumatoid arthritis kind of interestingly attacks more the small joints in the body, the toes, the hands, the wrists. So the first way to help arthritis from a holistic point of view is to mobilize the joint. And that could be through physical therapy, or that could be through a yoga class, or Tai Chi class, or a water aerobics class. Just to get in there and move the joints gently to begin to strengthen them and free them up. Because the less we use a joint, the more stuck it tends to get. The second thing I would advise a person is to take some natural anti-inflammatory support. You could still keep taking your pain meds if you need pain meds, but to at least get on board some herbal support that's sort of globally anti-inflammatory for your body, that quells those tendencies to flare up and cause pain and inflammation. So those would include herbs like ginger and turmeric, and fish oils. And the third thing that really helps arthritis is to look at your diet and how you digest. Poor digestion, even if you're eating good food, can create sort of a residue, a congestion in the body that can impact the joints. And foods that are refined, that are chock full of preservatives or additives, chemicals, are also more inflammatory to the body. And even hot spices, caffeine, white sugar are all more acidic in the body. They all promote pain, basically. So to look at your diet and try to modify some of those factors is really helpful. And the great thing really is to know that it's not permanent. So often people get told, you have arthritis, expect it to get worse. And the truth is, if you have arthritis, there are ways for you to work with it so that you actually see improvement in your joints instead of a gradual decline.